سوا على الهوا سوا على طول سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطني الموج كنا سوا.
Good morning and thank you for being with us. This is Khalil Hachem, editor of Michigan.com, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. This show is brought to you in cooperation between Michigan.com and US Arab Radio. Today is Tuesday, August 18th, 2020. Summer is almost gone and getting ready to go back to school, and fall will be here and the snow will be here before we know it. We're not complaining. We thank the Lord. The weather is warm and pleasant. Temperature could reach or hover around the low 80s. It's a great summer weather. Enjoy it. I want to thank you for being with us. The number here is 248-557-3300. Please give us a call should you have a question or a comment. I want to say good morning to all of you. Good morning, Dylan. How are you today?
Good morning, Amu. How are you?
Good. I want to thank Dylan for being with us this morning and producing this wonderful show. Is Dr. Shamma with us today?
Yes, he's on the line.
Hi, Khalil. How are you? Good morning.
Okay. Good morning. How are you?
I am well. Thank you for asking. And
wonderful.
Good morning to everybody that's listening to us in Michigan and anywhere else.
Absolutely. Thank you so much for being with us today. You know, the new coronavirus has dominated every aspect of our lives and restricted medical care to emergency cases, postponing elective surgeries, procedures, in all disciplines. You know, people who wanted to get pregnant, people who wanted to have other minor surgeries, even people who just wanted to go to the doctor have postponed it because they were either afraid to go or these things were available. Well, while the battle against the COVID-19 pandemic continues, life goes on, and elective medicine has returned with modification and balance between fighting the virus and providing safe care for clients. Again, elective surgery we're talking about, or elective medicine we're talking about, fertility, plastic surgery, pregnancy, people going for a blood test, so forth and so on. And today we are fortunate to have with us our good friend, Dr. Nicholas Shamma, renowned fertility specialist, award-renowned fertility specialist, to discuss how did he adjusted to the COVID-19 and how are they tailoring their services to provide the good service that they're well known for, even though, the visit to the doctor is still safe. And I also like to remind you that Dr. Shamma is a founding member of IVF Michigan Fertility Center and one of the leading reproductive and infertility specialists in Michigan, Ohio, and the Middle East. A Lebanese-American physician, Dr. Shamma has performed more than 8,000 IVF cases worldwide and has more than 150 publications in the field. We are so blessed to have you, Dr. Shamma, with us. Thank you so much for your time and being with us this morning.
Yeah, I thank you for having me, Khalil, and again, good morning to all the listeners in Michigan and Ohio, and if they can hear us in the Middle East and certainly in Lebanon, good morning or good afternoon to all of them over there. I want to start by telling you that COVID has been a very devastating ailment to the United States and to the rest of the world. It is, in my career, I've been a physician since 1986, so almost 34 years now. And I can tell you that this is nothing that I have been expecting to see in my lifetime. And so this is one aspect that has, for the past 6 months, and I'm going to use that word, terrorized us in the medical community, terrorized us as human beings, and upset every aspect of our well-being in our society. It affected young ones, old ones. All of us were affected, and it's a virus that has. I wish to some degree that the World Health Organization or the people that have power on this planet had spent some time preemptively to take pandemic into consideration, or other pandemics, because I'm sure there'll be other pandemics, and there was previous pandemics in the world, took that into consideration in providing protocols and procedures in place to mitigate or decrease the spread of something like COVID. So that's one aspect. And me being Lebanese, I have to tell you that the past 2 weeks has been horrible for us and the Lebanese-American.
Yeah.
As a Lebanese-American, and I can tell you that loved ones, relatives, and friends have been affected. I mean, people that, like myself, who have homes and stuff in the Middle East also were affected. But the loss of life, the homelessness, the destruction is unprecedented. I mean, over there. So not to even mention COVID-19 in places like the Middle East. With that being said, I mean, life goes on, as we say here in the U.S., and we have to take care of ourselves, our loved ones, and our patients.
Absolutely.
And so we can spend the rest of the time talking about what we can do in as far as COVID. And maybe we should start, Khalil, telling a little bit about what COVID, how it started, and
Exactly.
How do we get it?
Let's give
and then we'll talk about
update. Yeah. Absolutely. Yeah. Let's give a refresher and an update on where we are. Last time we talked, it was about 5 months ago. So what have we learned so far? And what is COVID, as you said?
Well, I mean, people that I'm sure everybody knows what COVID is, but it's a virus. It's what we call an RNA virus. There are types of viruses. Some of them are RNA, some are DNA viruses. And these viruses, it originated in China, in Wuhan, everybody knows, back in December, I think. And for some odd reason, the world didn't take the heed early on. And for some reason, I think the people over there in Wuhan and China in general did not tell the rest of the world the enormity of the situation. And unfortunately, because of the world is so small and they allowed travel out of China for a period of time to Europe and eventually to the U.S., the virus spread. And this virus is a very, very infectious virus. I mean, it's what we call a coronavirus. So we've had coronavirus before. Actually, the common cold is a coronavirus, and there are 4 of those. Mm-hmm. But this virus is similar to 2 other previous deadly viruses. One of them started again in China several years back, called SARS, and that actually was prevented from spreading because of certain steps that were taken early on. And then there was a similar virus actually that started in the Arabian Peninsula called MERS, Middle Eastern Respiratory virus, and that virus also is a coronavirus, and thank God, actually, it didn't even spread. It was even deadlier than coronavirus, the current one, than COVID-19, COVID-2, and it was prevented from spreading worldwide. Now, those viruses, Khalil, spread by most of the time by droplet transmission, which means that somebody has to cough on you, has to talk next to you, or to sneeze next to you, so the virus can spread. And there are other potential modalities of maybe virus spread through what we call aerosols, and these are tiny droplets that stay floating in the air for a period of time, or fomites, which is like doorknobs and metal surfaces or things that we touch, or clothes even. But most of the time, the rate of transmission has to do with direct exposure to the droplets of the virus from somebody who has the virus. And what makes this virus so unique, in a sense, is 2 things. Number one is how infectious it is. I mean, it's amazingly infectious. You don't need to spend too much time next to somebody who has the virus and spreading it to catch it. And number 2 is how deadly it is compared to other viruses that we've known, like the common cold, which is a coronavirus, or like even the flu virus, which we get every single year. That has, it's not similar to coronaviruses, but it's we're talking about a mortality rate of orders of magnitude smaller. So whereas one of them, certainly has to do with age, and we'll talk about that in a minute. But if you look at mortality rate, for instance, from influenza, it's only 0.1%, whereas the mortality rate from coronaviruses, if you look how many cases worldwide exist and how many deaths have occurred, it's probably somewhere in the 3 to 5% range in certain areas. And therefore, we're talking about orders of magnitude greater. Now, the other thing that makes this virus also unique, it affects certain populations more than other populations. So it's clearly everybody can be exposed to the virus and everybody can potentially get the virus, but the manifestations of the virus, basically the symptoms that we get and how deadly it is varies. Just to put this in context, for instance, if you're a young person somewhere, a young child or a teenager between 5 and 17 years of age, God forbid, the death rate is less than 0.3%, very similar to the influenza rate, actually, in the general influenza rate. Whereas if you're above the age of 85 and you catch COVID, 30% of the time you're going to die. So that's what makes this virus so unique, because it affected fragile populations, the older populations, the populations that have what we call comorbidities. And to understand what comorbidities is, we're talking about, let's say, hypertension, diabetes, cardiovascular disease, renal disease, pulmonary disease, etc. And think about it this way. Most of us adults, 25% of us have a comorbidity. So 25% of us have either high blood pressure or diabetes or cardiovascular disease, especially as we get older. And think about obesity. Obesity itself is a major risk factor. And the other unique thing about this virus, it also affected certain ethnic groups more than other groups. So lower socioeconomic classes seem to have more comorbidities, so it affected it more. African Americans seem to be more affected than Caucasians. For some reason, males more than females.
Do we know why, doctor?
Actually, we do have. We do have some potential explanation. Why? What? What's the? Because is it because of
why does it affect? No. Why does it affect African Americans more than Caucasians?
I think nobody really knows at the end of the day what the reason is, but patients who are of African American descent seem to have more comorbidities than patients that are Caucasians. That's literally basically it. And if you factor that in, yes, there is still some increased risk, but not dramatically like we've seen. Also, Hispanics are to the same degree. Unfortunately, we have no studies in the Middle Eastern population that I belong to. It's weird that nobody ever mentioned this, but you would expect somebody from Michigan, let's say, at some of the larger institutions, to have looked at the subgroup of Middle Eastern populace and seen if there was an increased risk of some sort in that population compared to the general population. So I can't tell you that. But what is also interesting, I thought you were going to ask this, and I don't know the answer to it, is why men are affected at a ratio of 6-4 compared to women. So men seem to fare worse when they get the virus compared to women who get the virus. The other thing that also has to also be placed in context is, opposed to other viruses, this virus can spread in two situations which are weird situations. One is if you're completely asymptomatic, if you completely have no symptoms but harbor the virus inside you, you can actually spread the virus by talking, by sneezing, by coughing, by coming close to people, by hugging, all of that stuff. The second thing is that in the few days before you develop your symptoms, for at least 3 to 4 days, before you have even any symptoms, even if you're going to have the symptoms. So we're not talking about asymptomatic people, we're talking people who were infected, and eventually they're going to have symptoms 3 to 4 days later. But in those 3 to 4 days, before you have zero symptoms, you are actually able to spread the virus. And clearly can spread it after you have the symptoms. And again, the rate of spread is clearly more when you have symptoms than you have pre-symptoms. And certainly if you are going to be completely asymptomatic, the rate of spread is substantially lower. And some people actually debate if you can actually spread it or not. And it lasts.
What we're going to do? What we're going to do, Doctor, we're going to take a short break and we'll be right back. And then we'll continue this thought, if you don't mind.
Sure.
مراكز IVF ميشيغان للخصوبة وأطفال الأنابيب الرواد في مجال الطب التناسلي تعلن عن استقبال مراجعيها في بلومفيلد هيلز ومراكزها المنتشرة في ميشيغان وأوهايو، حيث يتواجد أمهر الأخصائيين لتقديم الاستشارات في جميع مجالات التلقيح الصناعي. يعتبر الدكتور نيكولاس شاما أحد أهم الأخصائيين في الغدد الصماء التناسلية في ولايتي ميشيغان وأوهايو، حيث أجرى أكثر من 10,000 عملية طفل أنبوب وساعد الآلاف من الأزواج على تحقيق حلم الأبوة. يحمل الدكتور شاما شهادة البورد الأمريكي في كل من أمراض النساء والتوليد، أمراض الغدد الصماء التناسلية والعقم، رعاية طبية ممتازة وتفهم عميق للأثر العاطفي والنفسي لحالة العقم. للاستفسار اتصلوا على 248-952-9600 248-952-9600.
Welcome back, and thank you for being with us. This morning we're talking to Dr. Nicholas Shamma. We're talking about the coronavirus and how it has affected elective medicine. And before I go back to Dr. Shamma, Dylan, do we have Jerry still on the line?
Yes, here he is.
Jerry, good morning. We don't have a lot of time. If you have a question, please go ahead with very quickly.
Okay, thank you, Mr. Khalil Hachem, for taking my call. Good morning to you, and thank you, producer, Mr. Dylan George Arabu. Dr. Shamma, this is Jerry Habba. Good morning to you, and I want to thank you for your service, Dr. Nikolai Shamma.
You're welcome, and thank you for your kind words.
Thank you, Dr. Shamma. My question to you, Dr. Shamma, every year the flu kills 200,000 American citizens. My question is, right now, Corona, the victim is over 165,000 since 5 months ago. My question, Dr. Shamma, why the media and why the health department make it a big issue when the flu killing more people every year? I would love your answer, and thank you, and God bless you.
Thank you.
Well,
we appreciate it, Jerry.
It's
a very good question.
Well, actually, the answer is actually very simple. If you think about the fact that the flu affects almost 350 million people in the United States, but kills somewhere around, that's the number that Jerry said, I'm not exactly sure of the exact number, but we're talking, let's say 100, 200,000 even. But it affects almost a population of 350 million. If we want to do the same math for the coronavirus, we're talking about 350 million people in the United States. 80% of those will be affected. So you're talking somewhere closer to 300 million. If 5%, 3 to 5% of the people die from it, you're talking about a death rate of substantial death rate. I mean, even a third.
Absolutely.
We're talking about somewhere between 5 and 15 million people. So that is if we do not take mitigating steps. So this is very different than the flu, extremely different than the flu. Plus, remember something. That's the first part of the answer. The second part of the answer is also obvious. There is a vaccine for the flu. Yes, it's not the greatest vaccine, but it's at least 40-50% effective. And if you get it, you get a milder form of it. Now, for this COVID-19, currently, and until next year, maybe mid-next year, there is no vaccine. So therefore, we cannot mitigate its spread by just hoping that we just get it and get over it. Because if we just get it and get over it, then millions, now we're talking about hundreds of thousands, millions people will die, especially the older population. So why are we making a big deal of it? Because it is a big deal.
It is a big deal, absolutely.
Yeah.
Now, Doctor, I noticed that it affects people differently. Is it the same virus? Is the virus mutating, or is it that our bodies react differently to it?
No, actually, not to get into too many technical, medical-related issues. but the virus has mutated since its inception in China. And I have to tell you something about this virus. I mean, it is endemic in bats in China, and then there was probably a middle reservoir called the mango, and it's a sort of an animal, Chinese animal, I guess. And then it spread to humans, but it has mutated. It was less virulent when it was in China, and substantially more virulent, more infectious, and more deadly as it spread throughout the world. And So I mean, this virus has been going on since earlier this year, and I would bet that it's going to continue to mutate. And what you hope for eventually, when we talk about, if we have a few minutes to talk about vaccines, we hope whatever vaccines we're developing now are going to address the ability to kill the virus or prevent us from getting infected by the virus, despite its mutative capacity, because all viruses mutate. I mean, to escape actually the eventual destruction. So I mean, the mutation is going to happen, and it's happening.
Sure. Now they're currently testing they're in phase 3, and they're testing the vaccine. And this is, as you well know, a very important period, because they're testing it on people. And I hope that, politics doesn't influence this period, because it's so important. Well, what are your thoughts on that?
I mean, oh my God. I mean, there's no question, unfortunately, that politics is playing a role with vaccine development. There's no question in my mind. And let me tell you what I mean by that. See, vaccines are developed by pharmaceutical companies, and they do it most of the time for profit-relating reasons. Now, unfortunately, here in the United States, the government is subsidizing certain vaccine development developing companies, and not others, even though we don't really know if any of those vaccines are effective, and we don't know what side effects they might or might not have. To give you an idea about vaccines, I mean, vaccines could either be an inactivated virus, so they take the same COVID-2 virus and change it a little bit to make it inactive, or the vaccine involves taking a part of the virus, the spike protein of the virus, and developing making a protein of it, and then injecting it, and hope that the body develops an immune response to it that will eventually kill the virus or destroy the virus when the real virus comes. Or now there are novel approaches using RNA technology and DNA technology that seem to be promising. The problem with a lot of the, at least phase 1 trials of those vaccines, is that some of them, or most of them, I should tell you, were used in younger people, Khalil, and even especially there was the ones that are developed in England, in Oxford, or there is another company here in the United States that developed an RNA vaccine. I don't want to mention any companies, but those vaccines had apparently level 2 and level 3 reactions in even younger healthy adults. So I can imagine what would happen if you give the vaccine to older people. And we don't have any phase 3 trials to assess that yet. And we don't even know if phase 3 trials, whether that vaccine is going to protect us. And most importantly, we don't know how long the immunity is going to last, because it looks like currently if you get COVID, by 3 months your antibodies are gone, so you can get COVID again.
Yeah, I was going to ask you about the immunity. Yeah.
Well, whatever vaccine we develop has to be given multiple times and numerous occasions. There's one vaccine, actually, one company that developed a DNA vaccine, for instance, and that DNA vaccine seems to have actually no side effects, to my knowledge, according to the phase 1 trial, but they're starting a phase 2 to 3 trial sometime in September, I think. So, I mean, not only do we need to find a vaccine, but we need to find an effective vaccine that works and prevents us from getting a virus over an extended period of time. I mean, more than 3 months, in my opinion. Otherwise, every 3 months, can you imagine if you give a vaccine every 3 months? And then the second...
yeah, I know.
And the second, Khalil, is obvious. It has to be able to be... has minimal side effects, because people won't take it. Yeah. I mean, think about the flu. Only half the population takes the flu vaccine, even though it's readily available. Everybody can take it. Even you go to any pharmacy, they give it to you. So, and the other a third part of the equation about vaccines has to do with distribution and manufacturing. I mean, you should be able to produce a vaccine. If you only produce 1 million doses and you have 350 million people in the United States, I mean, it might be an issue here.
Absolutely.
At the end of the day, you need to be able to manufacture it and distribute it efficiently and effectively. And some of those vaccines, there's a vaccine like an RNA vaccine that's now being tested. I mean, you need to keep it at minus 80 degrees Celsius. I mean, imagine. I mean, where do you find a fridge that is minus 80 degrees Celsius? I can tell you, as an infertility subspecialist, and we have a huge laboratory, to have a freezer that allows the temperature go down to minus 80 degrees is a major deal. So not everybody has it.
Yeah.
How could you maintain the vaccine? Now, thank God there are some DNA vaccines that can exist for a year in stable situations at the regular refrigeration, and several months even at room temperature. So, I mean, vaccines are being developed. At the end of the day, God willing, we'll have an effective vaccine that lasts, that has minimal side effects, and that can provide immunity for a period of time and can be manufactured easily, I guess, and distributed. So these are all the components of the vaccine. And I can tell you this is not happening before sometime in the middle of next year, I think, or early next year, not to be pessimistic, but I mean, I'm a realist at the end of the day.
Sure. Now, as far as viral medication, we still don't have anything effective to counter this virus. Is that correct?
Nothing. I mean, remember the big thing with Plaquenil or hydroxychloroquine. I mean, in my field as a subspecialist, I have used Plaquenil for years. And Plaquenil is for people that don't know what it is. It's hydroxychloroquine. It's what President Trump took when he got potentially exposed, I should say, and took it for a couple of weeks. But people have tried. So this medication is used for people that have rheumatoid arthritis or lupus and so on, and has been used for years. And I've used it personally for years because apparently it modulates implantation and improves implantation. And actually, when COVID hit, we were unable to find it, to use it for the people that we give it to routinely. Because the state of Michigan said that you can only prescribe it under certain situations where people were taking it like willy-nilly, I mean, for no reason or good reason for that matter. Now, it appears, let's say, that modulator, or that drug, which was first studied in France and later on used sometime in the world, that it might potentially, I should say, affect the disease process if you use it early, very early in the disease, as soon as you get exposed, or maybe when you have very, very early symptoms. But most of the studies that have been done later on were done in hospitalized patients, and those really failed to show any difference whatsoever, actually.
Yeah.
So again, the data on this is debatable. Then there is another drug, talking about drugs, called remdesivir, and remdesivir is a drug that prevents RNA replication and has been shown to minimize your hospital stay by around 4 to 5 days in randomized prospective trials. But at the end of the day, you're hospitalized. And talking about hospitalization and what happens to you, I want to just put this virus in perspective and listen to this. 5% of people, Khalil, eventually get severe symptoms that require them to go to the ICU. And among those that ever get to a hospital, 1 in 5 or 20% of them eventually get into the ICU. But here is the thing. If you get to the ICU and you have COVID, unfortunately, God forbid, 40% of the time, you're not going to get out of the ICU. You're going to die.
Wow.
So that is how bad this virus is. So especially if you get to a hospital, I mean, I'm not saying you shouldn't go to a hospital if you're sick, but if you happen to need a hospital, or more so if you need an intensive care unit, the death rate is beyond imagination. We're talking about 40%, like almost 1 in 2 people that get into the ICU don't get out of the ICU. And I've had friends and colleagues even in the medical field that got affected and even needed intensive care treatment. And unfortunately, I know people that passed away from the virus, relatives and colleagues and friends, unfortunately. So that is what makes this virus so deadly, is that, I mean, there is no good treatment. There is no good treatment. So
unfortunately.
Therefore, until two things happen. Until we get a vaccine that is effective, and we said last, and we have to take mitigating efforts to prevent the spread as much as possible. And therefore, it is a big deal because we die when we get it. So to make a long story short, we should do all the mitigating steps that the government is telling us. And we don't know what those mitigating steps, what they should be, but we think, like most pandemics, you should, because it's an aerosolized droplet transmitted virus, you should maintain social distancing at least 6 feet. You should wear a mask all the time when you're next to other people. You should potentially, I'm not saying about you need to wear gloves, because at least don't touch your mask when you're wearing it. And most importantly, I mean, I worry about this. I see people wearing masks, and the mask is on their chin, not on their mouth or noses. I mean,
I see that a lot,
yeah, Khalil, even if you wear a mask properly, you shouldn't maybe wear a mask if you cannot, for whatever reason, wear it properly. So wear a mask properly and try not to touch your mask from the outside if you can avoid it. Wearing a mask, social distancing, and hand washing, or using products that have at least 70% alcohol in them, like Purell and otherwise, not to mention one, I mean, is the way to go to minimize the risk of exposure to the virus. And the last part of it is that if you are sick, or you think you are sick, or you think you have been exposed, by all means try to minimize your traveling, and you should isolate yourself. It's only right to do so. I cannot tell you the number of situations that I, as a physician, have encountered in our facility and with patients that I take care of. And we know that they are infected, and then you ask them, where are they? They're like at Costco shopping, or I mean, what the heck? You cannot, should not do that, because it's like, it's, in my opinion, it's as if you're carrying some horrible, deadly weapon and brandishing it and potentially using it. So if you think you're exposed, or you think you're symptomatic, please isolate yourself for the 10 days after symptoms appear that the CDC requires, or 14 days from exposure.
Yeah. What we're going to do, Doctor, we're going to take a short break. We'll be right back. Please stay tuned.
Okay. All right.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
Welcome back, and thank you for being with us. We're talking to Dr. Shamma about the coronavirus and how it has affected medicine. Dr. Shamma, how did the pandemic affect your practice?
Well, I mean, it has certainly affected my practice and all practices in the United States. So let me tell you how. We heard about this virus sometime in late or mid-February, and we didn't know how to deal with it. In the first few weeks in March, we were in a situation of complete panic. We didn't know what to do. And then we had orders from the state and to actually not do much of anything. So we spent the month from mid-March, I would say, till the end of April, where we actually didn't do any procedures. We didn't do anything. And I think I am glad we did this. And as a CEO of my company, I mean, I had enough time during that month and a half to put in place certain standard operating procedures. Even though we're a medical practice, and we could have continued working actually, but we decided not to continue doing procedures for the month and a half, and put in place multiple standard operating procedures that allow us to minimize as much as possible, or mitigate as much as possible, the transmission and the exposure to the virus to not just ourselves, my employees and laboratory personnel and so on, but also for the patients and their families eventually, and because these are extremely sensitive matters in terms of protecting everybody, the patients, the lab, the nurses, the front desk people. So we had to put a lot of procedures in place, Khalil, to mitigate the risk of transmission and prevent the exposure to the virus. Because you can imagine, I mean, if somebody comes into the office and exposes everybody in the office, then you're shut down for at least 2 weeks. And we, in vitro fertilization and in assisted reproduction, I mean, we have to take care of the embryos. So we had to take care of embryos don't live by themselves. We have to take care of them. It's like you have to nurture them until they're ready, and for each one of them is potential life. Not only this, I mean, there are so many things, let's say, that happen in the laboratory that require daily attention, and everything is monitored electronically all the time, but we need humans to do all the jobs. So you can imagine if all the humans are sick. And to put this in perspective, we have thousands, tens of thousands of frozen embryos in our facility. We're the largest in Michigan and Ohio. So we have tens of thousands of frozen embryos that require, let's say, liquid nitrogen to be able to sustain them. I was initially worried when this thing, but what if the companies that supply liquid nitrogen to us fail or stop supplying? Then what? Then what? Then what? So, I mean, I can tell you, Khalil, that this whole thing made us do so many extra steps in our field. And I would tell you today, as a practicing physician, as a manager of my corporation and so on, at least an hour per day, I spend on dealing with COVID-related issues. Every single day of every week since the pandemic hit us. To deal with situations that come up, with exposures, with things that we need to address. Now, we haven't spoken about pregnancy and fertility, but I think COVID affects things in two different ways. And before I address pregnancy and fertility, I want to tell you something about the stress and the psychological, toil of this pandemic on all of us. Myself, I mean, on our kids, on our loved ones, on our older people that are all by themselves now, and nobody looks at them because you can't visit them. I mean, I have a grandchild that I've seen her 6 times because my daughter thinks that I shouldn't come close to her, or even, I can see her from far, and that's basically it. But I'm telling you about the kids that are sitting at home, not going, not seeing their friends. It's a major stressor for those young adults. So even when schools start, I'm glad at least most schools in Michigan are doing video teaching, and I think that's the right approach. Otherwise, major issues will happen, in my opinion. But that's myself, and I am glad that is the case. and my kids, let's say, that live in Ann Arbor are going to be through the video conferencing and as far as learning for the coming school year. So that is one aspect. But in terms of fertility and pregnancy, I mean, think about this. Can you imagine if somebody we make pregnant and then 2 days later she has temperature of 104? I mean, what would that? How is that going to affect the pregnancy? Now, thank God, that it doesn't appear that the virus causes viremia. Viremia meaning that the virus only in 1% of the cases it circulates in the blood, which means that there has been no good studies showing yet that there is vertical transmission to the baby through when mommy is infected. But then certain babies got infected when mommy delivered the baby if mom was affected at the time of delivery. So the issue is, the babies seem to be protected. There were some studies suggesting higher rate of preterm delivery or higher rate of cesarean section. I think most of those were done only because of the situation that mom was in, requiring C-section. Now, the preterm delivery could be related to the hypoxia, the low oxygen tension that the babies were having, and the babies felt that they were in distress and they needed to come. But nobody knows for sure why that is the case. With that being said, it appears yet that pregnancy is not worsened by COVID, and vice versa. COVID doesn't affect dramatically the pregnancy, except maybe causing preterm delivery and more needs for cesarean delivery when that actually happens. So at least from the pregnancy perspective, it is an issue. Now, as far as fertility, it's a completely different story, Khalil, because here's the thing. We know time affects fertility, correct? So if time affects fertility, if you actually don't pursue your fertility options, by the time that you want to pursue it, then it's too late. Yeah. So women get older, women have a limited amount of eggs left, and if they postpone getting pregnant, then bad things can happen to them. So I think COVID is causing even more stress for people trying to get pregnant. If they cannot get pregnant, and they delay things until, let's say, this pandemic is over, this year and a half, if you're like 41 years of age or 39 years of age, is a major amount of time. I mean, that is lost. That can never be recuperated, by the way, ever. Yeah. So we are doing everything we can in our practice to, thank God, I mean, we're testing every single patient before every single procedure, going through any assisted reproductive procedures to mitigate the risks and so on, and with all sorts of extra steps that are taken in the office and whatnot to, again, mitigate transmission. So it appears that at this point in time, businesses have recovered, at least in the medical field, because we know what we need to do to prevent the transmission of the virus to the patients and so on. And clearly, if you have COVID, we're not going to let you get pregnant now until you get over the COVID, and God willing, in a positive way, and become at least no longer infectious to others, and you're symptom free. So that is basically what we're doing.
Okay, we're going to take a last break, and then we'll be right back. Please stay tuned.
All right, sure.
مراكز IVF ميشيغان للخصوبة وأطفال الأنابيب الرواد في مجال الطب التناسلي تعلن عن استقبال مراجعيها في بلومفيلد هيلز ومراكزها المنتشرة في ميشيغان وأوهايو، حيث يتواجد أمهر الأخصائيين لتقديم الاستشارات في جميع مجالات التلقيح الصناعي. يعتبر الدكتور نيكولاس شاما أحد أهم الأخصائيين في الغدد الصماء التناسلية في ولايتي ميشيغان وأوهايو، حيث أجرى أكثر من 10,000 عملية طفل أنبوب وساعد الآلاف من الأزواج على تحقيق حلم الأبوة. يحمل الدكتور شما شهادة البورد الأمريكي في كل من أمراض النساء والتوليد، أمراض الغدد الصماء التناسلية والعقم، رعاية طبية ممتازة وتفهم عميق للأثر العاطفي والنفسي لحالة العقم. للاستفسار اتصلوا على 248-952-9600 248-952-9600.
Welcome back, and thank you for being with us. We're going to continue with Dr. Shamma talking about how the COVID-19 has affected their practice. Dr. Shamma, are you back 100% where you were before COVID?
Yeah, I mean, actually, since May 1st, we were back 100%.
That's good.
Yeah.
I mean, and what should I expect as a patient when I come to your office?
Well, you cannot come to the office because except for procedures. So let me tell you what I mean. We in our field, we can do all our consults in telemedicine. So every single consult that we're doing is through telemedicine. At least we see the face of the people in telemedicine, because they come to the office. I have a mask and a face shield, and the patient has a mask and a face shield and so on. So we don't see one another. I mean, if the patient comes in as a new patient, I would never recognize her ever, correct? Because I don't see her face. So that is the beauty of telemedicine, because we can do all that stuff where we can see the patient, they can see us. You get that facial recognition is, in my opinion, a very important part of human behavior and interaction. So this telemedicine has revolutionized the way we interact with patients. So all of our consults or our return visits are done through telemedicine. But when the patient needs a procedure done, then they come into the office, and all of those steps are taken with social distancing, with face masking, gloves, spiral, all that stuff is done, and temperature checking and whatnot. And then we do whatever the necessary procedures. Now, for invasive procedures where they have to go to the OR, let's say, to retrieve eggs or to put embryos back or to do surgery to the uterus or the pelvis, then all those patients are required to have testing. Now, maybe we should spend also a minute or two about testing, because testing for COVID is not good. Testing, Khalil, for COVID was not good from the beginning and is not good still, believe it or not, because there's no good test. And there's something in medicine we call the sensitivity of a test. The sensitivity of a test is the following, is that if you are basically positive, and if you have a disease, what are the chances that test will test positive? And which means that the sensitivity, it depends when you do the test and what test you use. So if you do the very invasive nasal test we're talking about here, the nasopharyngeal one, which is not a very easy test to do, and you do it 3 days before exposure, it's only 30% positive. And if you do it when symptoms appear, it's 60% positive. And if you do it like 3 days after symptoms appear, so in the middle of your symptoms phase, then it becomes 80% effective or sensitive, meaning that it will detect the virus. So the moral of the story is that if you do not detect the virus, it doesn't mean you do not have COVID. It doesn't mean you go about to visit Sam's or Costco or go to your favorite neighborhood grocery store and infect other people. So that's what I'm trying to tell. Sometimes we make the diagnosis clinically, and people need to self-isolate and follow the rules despite a negative test, because of the lack of a perfect test that we can use. Now, eventually, there are what we call antibody tests. So to find out if you've been exposed in the past, there are some tests that we can do that seem to be positive. They're called IgM or IgG antibodies or both, that can tell us if you've been exposed. But that doesn't help us mitigate the transmission rate in people that have immediately had, having the virus or been exposed to the virus. And
absolutely.
And one thing I have to say, maybe, is I wish from the beginning, there could have been a way to mitigate, to prevent actually the transmission, but it's too late. We cannot do that anymore. But it has been done in China. And you can do it in countries like the Chinese did it because, they are draconian in their measures. They don't have free anything over there. And the country is controlled by whatever, communist dictatorship. So they made everybody stay home. If everybody stays home with the threat of, if you get out of your home, something bad happens to you, for 2 weeks, the virus can't jump out of the window, correct? So if you stay for 2 weeks, every every single person of the population, and the only people running around in the street are people wearing hazmat suits ready for the virus, then the virus ends. And that's how they were able to end it in Wuhan and in China. And that's why their economy is back on track. And we here are still, because of our liberties and our freedom, and I mean, we still have the virus. And
our politics, yeah.
But it's not just politics. This is actually human behavior. You cannot restrict free societies in general, but you can do that in a draconian way, which could be very effective, as I told you, in societies like in China or in North Korea or some other country where you lock the whole country, lock the people in their homes, and the only people that have been exposed, they can only expose other people in their household if they stay at home. And in 2 weeks, the virus ends.
Yeah.
But then you couldn't do that in the United States. You still allowed travel from Europe, and that's how we got all the cases. Even though the president tried to prevent everybody coming from China, but then what about Europe? And then they realized that Europe is a source, and then the genie is out of the bottle, and that's the end.
Exactly.
Yeah.
Is there anything I haven't asked you that people need to know about pregnancy or any other related issues that you deal with when it comes to COVID?
Well, I can tell you this. I mean, pregnant women are immunocompromised because that's how they prevent the rejection of the baby, correct? I mean, the baby is a foreign entity. So pregnant women in general should do everything humanly possible to prevent them catching the virus. That includes social distancing. That includes wearing masks. That includes washing their hands properly with soap for at least, half a minute or so. That includes using Purell. All of that needs to be done. And for pregnant women, and even people trying to get pregnant, they should do all those steps. Now, again, as I said, thank God it doesn't appear that COVID affects pregnancy in a very detrimental way, unlike the H1N1 flu virus, for instance, that we had several years ago, where pregnant women died much, much more commonly than other people. But here it appears, and for some degree, as we said, women seem to be protected. So the moral of the story is that try to do everything possible to prevent you from catching COVID. And all our patients that are pursuing fertility issues are actually doing that currently. And we tell them, and they are perfect in mitigating the risks to themselves and to their loved ones. And that includes also their husbands or their partners. Yeah. Because, you can't do all this stuff and then have your husband running around and exposing you and the rest of the family to the viruses. And that to some degree includes other modes of transmission from the kids. If you have older kids that insist on going out and going to parties and not social distancing and certainly not wearing masks. I mean, it's to some degree insane in my opinion, but all of those have to be done. All of those, Khalil, have to be done for us to control this virus until something dramatic happens, which means because we're not going to get herd immunity. If we have herd immunity, we're talking about millions of people dying. Yeah. If we cannot get herd immunity, the only solution to this is an effective vaccine that has minimal side effects. And I pray to God when we get that vaccine or multiple vaccines, I hope we're going to get multiple vaccines and we have the option of choosing the good ones, for instance. I mean, I have the vaccine of my choice, for instance, that I would potentially take. It's a DNA vaccine by a company called Inovio. But anyway, so if that comes into market, I'll probably take that before other vaccines. But the point is, I hope we stay well until an effective, safe vaccine comes in to be able to curtail the spread of this very horrible, viral infection.
Absolutely. It's on everybody's mind, as you mentioned. Recently I had to make a decision in regard to my children, whether I want to send them to school or not, and I opted for the online because I just don't feel that we have enough protection out there. And kids don't social distance. So and I don't want them to bring it home.
Thank God. Actually, I think you did the right decision. in the city of Ann Arbor, I can tell you, for the Ann Arbor Public Schools, the superintendent was wise to actually make the schools all online learning until something develops. So they gave the option eventually, if the schools, if the virus goes away, which is, it's not going to go away, and with the flu season coming, imagine flu plus COVID. Imagine flu plus COVID. So, and imagine a school where the hallways are narrow and there are high schoolers going from one class to the other. They're touching one another. They're close to one another. Some of them are sick, and they feel immune, or they feel most kids feel like they are like superhuman, and then nothing happens to them according to them. And that's how the virus spreads. And then they come back home and they God forbid, infect grandma and grandpa and dad and mom. And then who takes care of the kids if the parents are
exactly.
sick? Yeah. We don't live in a country like in the Middle East where our cousins are there, our aunts are there, our parents are there to help our like nuclear family. Here in the U.S., we're all by ourselves. So who takes care of the kids if the parents are sick?
Yeah,
I don't know the answer to that. And that's why I think you did the wise decision of pursuing online learning. And maybe it's not the greatest, but I can tell you it's better than
we do what we have to do.
Option.
Yeah.
It's better
to do what we have to do.
It's better than the other option. And may God protect each and every one of our listeners and keep them safe and healthy until a vaccine comes out. And I want to implore all our listeners, when an effective and safe vaccine comes in, please take it. Please take it. Number one. Number two, please, everyone, take the flu vaccine, because you do not want to have the flu virus being confused with the COVID virus.
Absolutely.
So whenever that flu vaccine comes in, it hasn't come in, I can tell you that, I know from my office. Once it happens, it is imperative that everyone this year takes it, not 50% of the population. Because the gentleman that called us and said there's 100,000 or whatever number of deaths from the flu virus yearly, most of the time that happens in people that haven't taken the vaccine.
Exactly.
If all of the population...
And we're out of time. I want to thank you so much for being with us today. This has been excellent and great information that you shared with us. And it's always great to talk to you, Doctor, and having you on the show.
And may God keep you and your family and our listeners safe and protect our nation and the rest of the world. Bye-bye.
Thank you. Thanks again. Thanks, Dylan. Thanks, everybody, for listening. Bye-bye now.